clinical health management, that is GST 303. So let me go through the introduction. Clinical management means the program that applies systems, science, incentives, and information to improve medical practice and assist both consumer and their support system to become engaged in a collaborative process designed to manage medical, social, behavioral, work conditions more effectively. That is the brief introduction of what is meant by clinical management. You know, in every sector, in every facet of life, we must have management, whether in the administrative sector, in the accounting sector, and likewise, we also have what we call management in the clinical health sector. So the basic idea of having this management is to ensure that each patient, each client that comes to clinic, at the end of the day, such a patient gets exactly what he or she wants. That is the healthcare services that such a patient wants. Such a person must have the value at the end of the day. So that's why we have concept of value creation in healthcare. What is concept of value creation in healthcare? The value creation process signifies the dialogue and the activities taking place between patients and doctor. It is a service process and the meeting between care seeker and doctor as a service meeting between a client and a service provider. This simply means that the dialogue that exists between the client, the patient, and the doctor. So that is what is meant by this process. So over the years, value has played a key role in the healthcare practice. Innovation in medical and the increasing importance of patient centeredness have contributed to influence and draw the attention of the medical community. However, a large consensus on the meaning of value is still lacking. That is, patients, physicians, key policymakers, and other healthcare professionals have different ideas on which component of value may play a prominent vital role. That is, at this junction, what I'm trying to say is that the patient, the physician, and policymakers, that is, the executor of policy, the, the executive. So all these and the other healthcare professionals, they have different ideas, which at the end of the day, they are to articulate together to form a vital role so that, by articulating those ideas together, they will arrive at a logical conclusion in order to achieve what we are trying to achieve at the end of the day as regards the clinical healthcare management for a patient. Meanwhile, nowadays, value is a prominent topical issue in healthcare. Individual needs, wishes, preference, and ethics influence. The meaning of value, which in terms is influenced in different cultures or historical periods. It is commonly accepted that values in healthcare may be defined in normative guidelines, helping to evaluate action or situation and influencing decision-making process. The value-based system refers to personalized care, where patients' expectations and needs are included in a holistic approach of medicine that considers physical, mental, and spiritual well-being. Physician and patient should change their point of view since both are actively and equally involved. One with clinical knowledge and order we choose our life. What we are trying to say by this is that both we should change our orientation so that at the end of the day, because we are both actively involved, we are both parties, the physician and the patient. The end point is not is our goal, is our target. So we should change our orientation towards each other in order to achieve the same objective at the end of the day. Some of the important values for healthcare professionals are these are some of the important values for healthcare professionals. Because we need this also is a key point that need to be considered in the healthcare management system. Working together for patients, patient comes first in everything we do. This is what most healthcare professionals have to put into consideration because like in a normal thing, they normally say customers are always right. You know, if a patient or a client comes to the clinic or the hospital setting, that is, no matter how little, even even when we are having care, no matter how little, such a client might at the end of the day may have to pay little. Other folks okay. At times it's okay. You have to pay for registration, you have to buy card, you have to buy this, you have to buy that. So in this kind of scenario, that means the patient is is in the position of the customer. So and we normally believe that customers are always right. So for healthcare professionals, we must put the patient first in everything we do. That is working together for patient. Patient come first in everything we do. Secondly, the patient must be respected and there must be compassion and we must have the spirit of improving life of such patients because there is what we call at least at times we might be we might be forced to offer a kind of first aid which is to recover life first before proceeding to another level. So, and everyone can in the process, everyone can. So then we now move to process design. Process design in healthcare management. Healthcare is a highly complex socio-technical system that contains a number of subsystems and processes needed to provide safe, efficient, and effective patient care. Conventionally, process design was conducted in relative isolation without serious consideration of potential impact on downstream process and function. Process design in healthcare requires a multifaceted approach that includes systematic application of the process design and improvement within the defined process design framework. It is also important to ensure meaningful staff involvement, build strong safety culture, control factors that influence human performance, and foster driving innovations while keeping patient needs at the forefront. Process design may, however, depend on the organization capability and culture. That is, when you're having a process design in a healthcare management system, there are some variables, there are some factors, there are some parameters, there are some yardsticks that you need to consider. Well, most of those things will may likely rely on the management of such establishment because they are the ones to maybe to design the culture and some other organization capability. That is what other workers, that is the maybe the nurse, the doctors, the laboratory staff, and so many other clinicians. That is what they are to follow. So we now move to planning. Planning in healthcare, like we have planning in every other sector of the economy. Planning in healthcare can be defined as a systematic approach to attaining explicit objectives for the future through the efficient and use of resources available now and in future. Planning is an important for health practitioner. That is, planning is very important, it's very key for all health practitioners because you must plan. You must plan your line of action, what you are doing currently, assuming that okay, even before as a surgeon, even if you are to perform any operation, you have to plan, you have to have your team. Okay, this is my anesthetic nurse, this is my anesthetician. So you have to plan. Planning is very key. Don't just go or dabble into any serious operation like that. You must plan. Planning is an important skill for health practitioners because it's a key management function for all health workers and health managers. Planning is the process of determining in advance what will be accomplished, when, by whom, how, and at what cost. There are 8 stages of healthcare planning: situation, situational analysis, problem identification and prioritization, objective setting, strategic formulation, sequencing of activities, resource allocation, action planning, and monitoring control. Then we now move to strategic planning. Strategic planning is an organization process of defining the strategy or direction and making decisions on allocating resources to pursue this strategy. It may also extend to control mechanisms for guiding the implementation of the strategy. That's strategic planning. There are different strategies that can be applied in healthcare management to produce value, and these strategies can be linked to effective management and leadership practice. So, I don't know, maybe I'm still within the time frame. However, uh, before I move on, I want to give you a assignment so that when next we are our class, when next we are meeting, probably we are going to work on it. So, explain briefly 5 important values for healthcare professionals. Explain briefly 5 important values for healthcare professionals. So, and by the grace of God, in our next class, we shall be talking on strategies, different strategies that can be applied in healthcare management to produce value. And we are also going to be linking these strategies to effective management and leadership practice. My moderator, I don't know, maybe there are room for question and answer section. If there is no room for that, maybe I can just in my lecture again. Like I said earlier on, hello, hello, Mr. Yomi, hello, hello, hello,
Good evening, sir.
hello. Good evening.
Mr. Folabi,
Hello.
Uh, Hello,
Mr. Falabi, can you hear me?
I can hear you. I can hear you, sir. Hello,
All
Mr.
right.
Yomi, I can
Your
hear
class
you.
is still to 6. The students can. Unmute yourself, please. Hello. Mute yourself.
I can hear
I
you
can
now.
hear you now. I can hear you.
Okay. I think maybe if they have one or two questions, I can quickly brush over. Hello, can you hear me? Uh, hello, maybe I should explain further on
Go,
the
go
concept
ahead. Go ahead.
of value
You
creation
are
in
clear
healthcare
now.
management.
You are clear now.
Okay, thank you. Okay, they are clear now. So,
Yes, go ahead. You can hear
as
you.
when we are talking, okay, thank you, Mr. Omi. When we are talking in relation to healthcare management, the basic thing, the fundamental thing that should be paramount to our mind is to offer the best services to the client or the patient. In some instances, there is what we call SAVICOM, that is responsive service delivery. But in clinical health management, what should be paramount to us is to give the best of our services to our clients, to our patients, which is also regarded as customer in this situation now. That is the most important thing. So there is no more about clinical care management, but what should be paramount to us, what should what we should give the priority is how to offer the best of our services to, to our clients. So, and one of the major, as regards the syllabus, one of the major topics, one of the major points that we need to assimilate and get very, very important about is the concept of value creation in healthcare management. The value creating process signifies dialogue and activity taking place between patient and doctor. It is a service process and the meeting between caretaker and doctor as a service meeting between a client and a service provider. Important. Concept of value
Your
creation
voice is
in
not clear.
healthcare management. Like I said before, over the years, value has played in the healthcare practice. Innovation in medical practice and increasing importance of patient centeredness have contributed is still lacking. That is, this is our present situation of things. I said, however, a large consensus on the meaning of value is still lacking. Patients, physicians, policymakers, and other healthcare professionals have different ideas which component of value may play a prominent vital role. That is, till, till this present day, we still have a large consensus. That is, we are still lacking the mutual understanding. We are still not working on the same page. That is, the patients and other healthcare professionals. We are yet to be working on the same page, most especially in developing countries. So, and that's one of the essence of having this course, healthcare management professionals, so that we'll be improving on the existing protocols as time goes on. Meanwhile, nowadays, value is a prominent topical issue in healthcare. Individual needs, wishes, preference, and ethics influence. The meaning of value, which in turn is influenced by different culture or historical period. That is, there are a lot of factors that are also influence the value chain we are talking about. We have different culture and we have different historical periods that can influence the value. It is commonly accepted that value in healthcare will be defined as normative guideline, helping us to evaluate action or situation and influencing the decision. Refers to a personalized care where patients' expectations and needs are included in a holistic approach of medicine that consider physical, mental, and spiritual well-being. Physician and patient should change their point of view since both are actively and equally involved. This is another salient point. One with clinical knowledge, another with our lab. Some important value for healthcare professionals. So you need to keep this at the back of your mind. These are some of the important values that must be exhibited by all healthcare professionals working together for people. That is, there must be synergy between the all healthcare professionals. There must be synergy between them, right from the cleaner, right from the gate, and we also have the physician, the doctor. So all these, they are all players. So there must be synergy between all the players working together for patients. So if we all believe we are working together for the patient, in everything we do, the patient must come first. Then we must have respect and dignity for patients. That is, we must not look down on any patient. So we must have respect and dignity for them. Then compassion, we must be compassionate. And we must have the the idea of improving life at all costs, then everyone counts in the system. So my time is fast running up. So let me quickly brush over to the assignment giving. So the assignment giving is explain briefly five important values for healthcare professionals. So and on this note, I also want to admonish us that we must stay safe in this pandemic situation we find ourselves now. We must obey and adhere to all the hygiene rules as prescribed by NCDC. We must always wash our hands. We must ensure social and physical distance, and we must make sure that we clean all surfaces that you might that might be suspected to have been infected one way or the other. We must use our nose mask all the time, especially when we are going out. So if there is need for us to go out at all, we must use our nose mask or surgical mask. So by doing that, I believe it is well with us. So thank you and God bless. We shall be meeting next week. Thank you.